the title is stroke and what everyone should know about stroke. So first off, a stroke basically is any interruption of blood flow to the brain. So the brain is a very active organ in our body. It needs a lot of blood flow to maintain its activity. In the blood we have oxygen and nutrients that feed the brain so that the cells function appropriately. So when a stroke happens, there are two mechanisms that stroke can happen in. Either there is a blockage of blood flow or a blood vessel may rupture, and then this will cause the blood to seep into the brain and not go to the brain tissues that it needs to go to. So those are sort of the mechanisms that stroke can happen. Like I said, stroke is the fourth leading cause of death in this country, and this is behind heart disease, cancer, and chronic lung conditions. Each year, close to about 1 million people suffer from a stroke, and someone dies of a stroke every 3 to 4 minutes. So if you think about that, it's a very significant disease that we need to be active in treating and preventing. Stroke is a leading cause of long-term disability. There are about 6 million stroke survivors in the U.S. today. And annually, the cost for stroke-related costs runs in the billions. In 2009, it was estimated to be over 63 billion. So it's a significant burden on the society. So the two types of strokes are ischemic strokes and hemorrhagic strokes. Ischemic strokes occur when there is a blockage of blood flow in a blood vessel, and this causes a disruption of blood to a certain part of the brain. The second type of stroke is a hemorrhagic stroke. So this is where there is actual bleeding into the brain, and this usually occurs when there is a rupture of a weakened blood vessel. Most strokes, about 80% of strokes, are the ischemic type, and then the rest are this hemorrhagic type. So this is a little picture of how ischemic strokes occur. We all, over time, develop fatty deposits in the lining of our blood vessels. And if we have certain risk factors like having high cholesterol, if we smoke, so on and so forth, we develop more of these deposits. When these deposits break, it causes some inflammation, and a lot of cells come to the area where the fatty deposits are broken, and it causes a clot to develop on top of that. And as that clot gets bigger, it narrows the blood vessel, and it can eventually block the blood vessel. So this is called thrombosis. The second mechanism of ischemic stroke is embolism. So an embolus basically is a particle that dislodges, usually it's from the heart or from the blood vessel lining itself. It breaks off and it travels through the blood vessels and into the blood vessels in the brain, and it lodges somewhere, and then that's how it causes a blockage of blood flow. Most emboli occur from the heart. So a lot of people develop abnormal heart rhythms like atrial fibrillation, and they become prone to developing blood clots, and these blood clots can then dislodge and go up to the brain and block blood flow. Okay, so this is just a little picture that we have here to illustrate what happens when a thrombus or an embolus develops in the artery. So you can see the normal blood flow is going to the right over there. The normal cells are traveling into that blood vessel to the side. When there is a blockage in this blood vessel going up, you see no blood flow occurring in that area. And the longer that blockage is there, the tissue in the nearby area starts to die off, and then the brain cells stop functioning, and that's when you have a stroke. Okay. Another term that I just want to throw out there is something called a TIA, which stands for Transient Ischemic Attack. A lot of people call these mini strokes. And basically what a transient ischemic attack is, it's a warning type of stroke. So what happens is you have the same thing. There's a blockage of blood flow to a certain part of the brain, but it's transient. Something happens to reestablish that blood flow. So a person may have symptoms for a little while. Usually it's a couple of minutes. And there's a disruption of the blood flow, they have symptoms, and something happens, and suddenly blood flow is reestablished, and they return back to normal. And then when these people get MRIs, CAT scans, everything looks normal, there's no sign of a stroke, but when they talk about what kind of symptoms they had, we know that something happened to disrupt their blood flow. And this is very important to know about because the risk of having a stroke is very high in people who have warning signs such as this. So it's very important, even if a person returns back to normal, that they come to the emergency room right away so that we can make sure that they don't go on later to develop an actual stroke. So this basically is going over what I said again, but the important thing to remember here is that any of people who have a transient ischemic attack, they are about 10 times more likely to have strokes than people who don't have this. So it is a true emergency. So, you know, a lot of the times we run into a situation where a person comes in with a stroke, and after we talk to them, they'll say, oh, you know, yesterday I was having these weird symptoms on this side. I couldn't feel things. I was numb. But then it came back to normal and everything was fine. And then they come in the next day and it's completely numb again and they have a stroke. So we shouldn't take these things lightly. So the second type of stroke was the hemorrhagic stroke that I mentioned before. And so this is a little picture of what happens with a hemorrhagic stroke. What happens is that the blood vessels, certain areas of the blood vessels become weak over time, and under the right conditions, they can rupture. The most common cause of hemorrhagic strokes is high blood pressure. So what happens is over time, because a person has high blood pressure, it puts a lot of pressure and stress on the blood vessels. And when a certain area of the blood vessel becomes weak, under the right conditions, if the pressure is high enough, it can cause a rupture of that area of the blood vessel. And so then blood will seep into the brain. Other things that may cause a hemorrhagic stroke include aneurysms. So an aneurysm is a ballooning of the blood vessel. So you can see here, this part of the blood vessel here, there's an outpouching. Why does an aneurysm develop? Some people are just born with it. It's congenital. Over time, it may get bigger. But some of the more common causes of aneurysms include smoking and high blood pressure. Again, it's the same thing, just having a weakened area of a blood vessel with stress being placed on it, and that part of the blood vessel starts to outpouch, and an aneurysm can form and actually grow. So this is another serious situation, because if an aneurysm grows to a certain size, it is at risk for rupturing. The other issue that we deal with that can cause hemorrhages is something called an arteriovenous malformation. So this is basically an abnormal tangle of blood vessels, and under the right conditions, these certain abnormal blood vessels can rupture and cause bleeding into the brain. So what kinds of symptoms can a person have from stroke? Well, no two people look alike. It really depends on which area of the brain is injured that will cause certain symptoms to develop. So this is just more of a straightforward illustration of the brain. This is a little bit more complex. The brain is actually, much more complex than this picture is showing. So different parts of the brain control different functions. So as you can see here, up there I have motor cortex that controls movement. Behind that we have sensory cortex, and that controls sensation. There are parts of the brain that control language, memory, hearing, balance, coordination, so on and so forth. And this is just, a picture showing the outside of the brain. Deeper in the brain, it gets even more complex. So that's why no two people look exactly alike. It's really the area of the brain that's injured that will result in certain stroke-like symptoms. So you may hear of people who have had a stroke and they look perfectly normal. You may hear of people who have a teeny tiny stroke and they're completely dependent on others for their care. And it really just depends on what area of the brain is injured. So, and this is just an example of where if a stroke affects the right side of the brain, I don't know if all of you are aware, but in the brain, things are crisscross. So the right side of the brain predominantly controls the left side of the body, and vice versa. So if a person has a big enough stroke on the right side of the brain, some of the symptoms they may have may include paralysis on the left side of the body. They may have visual spatial problems, they may have issues with behavior and sensory problems on the left side of their body, and they may also develop memory issues. People who have left-sided strokes may have paralysis of the right side of the body. They may have language language disturbances, problems with understanding, memory problems, behavioral issues, and these behavioral issues vary from person to person too. So these are sort of some ideas of what can happen. So these are 5 of the most common stroke warning signs. So the main thing that I want you to look at on this, every line starts with the word sudden. Stroke is a sudden thing. It's usually not something that develops over days or weeks. It usually hits immediately. So there's usually a sudden weakness or numbness on one side of the body, the face, arm, or leg, sudden confusion or trouble speaking or understanding, sudden trouble with their vision, sudden trouble with their balance, their walking, dizziness, sudden onset of severe headaches with no known cause. So these are important things to watch out for, and if anybody develops it, it's important that they recognize that these may be symptoms of a stroke. So the important thing is that if anyone has this or anyone you know has this, it's important to call 911 immediately. We often use the phrase time is brain, or time lost is brain lost. And basically what that means is that the longer the brain goes without appropriate blood flow, the more number of brain cells will die over time. And the sooner a person can get to the hospital, and the sooner we can give them the appropriate treatment they need to try to reverse the stroke, the more likely it is that we can actually help them recover from it. So this is just the stroke chain of survival that I have up here. So it's important that we need to get the word out there so that people recognize the symptoms of stroke. And once they recognize it, to call 911 immediately. And from there, we're educating our EMS to notify the hospital that they have a patient who has suffered a stroke, and to inform the ER to get ready so that they can assess the patient and treat the patient. And once the person arrives in the emergency room, that they undergo a rapid evaluation and diagnosis so that we can see what kind of treatment we can offer them. These are just a few pictures of different types of strokes. So the first picture, if you see here, this dark area in the brain, that's an example of what an ischemic stroke looks like. And once a person has a stroke, usually we could see it anytime they have a CAT scan or an MRI. There's an evidence of some scarring in the brain there. So it'll always be there. It doesn't go away. The second picture there is an example of what an intracerebral hemorrhage would look like. And the third picture is a bad situation where a person can have, if they have a big enough stroke, within the first few days of having a stroke, the brain starts to swell. And if it swells significantly, it can be a potentially fatal situation. So that's why it's very important for everyone to come to the hospital so we can watch them, monitor them, and if they do develop some complications from stroke, that we can treat them right away. So we have certain time parameters, and every stroke center follows these time parameters of how quickly we do certain things when a patient comes in through the ER. So when they arrive, our rule of thumb is that they must be evaluated within 10 minutes of arrival by the ER physician or a member of the stroke team. They should have a CAT scan within 25 minutes of arriving at the ER, and that the CAT scan be read within 20 minutes of it actually being done. Any blood work, labs, testing that's done should be reported within 45 minutes. And all of these time parameters we adhere to because we try to give, for any patient who qualifies for this medication called TPA, we try to give that TPA within 1 hour. So these are strict parameters that we follow, and we actually track this data, believe it or not, to make sure that we are treating our stroke patients appropriately. And the reason why we have these strict parameters with the TPA, we are finding that the sooner we administer this medication to patients, the more likely it is that they'll have a good outcome and potential reversal of their stroke. So TPA, you know, for those of you who may not be familiar, this is a clot busting medication. It's given intravenously. And we can give it up to 4.5 hours of symptom onset. So when a person was last known to be normal, or when they developed their stroke symptoms, we have up to 4.5 hours to give this medication and see if it will help improve their symptoms. So as far as, the treatment of strokes, like I said, with ischemic strokes, we have IV TPA. We also have endovascular procedures that we do, and these procedures are done at comprehensive stroke centers. What these procedures are basically, like cardiac catheterizations. We put a catheter in through the groin, we bring it to the blood vessel that's blocked, where the clot is, and once we're there, we can do a number of things. We can put the TPA right into the clot in the brain. We can use a various number of devices to try to pull the clot out or suck the clot out. We can even put stents in the vessels to help with pulling the clot out. So we're at a good place in time right now because we have a lot of different options that we can offer to patients depending on what type of stroke they have. Of course, the best sort of treatment is preventative treatment. So anytime somebody has a stroke, we carefully look at their risk factors. What are the possible things that led to their stroke? And everybody is different for why they have strokes. Young people have strokes for different reasons. So depending on age groups, risk factors, we have to decide how we're going to treat them so that they don't have another stroke in the future. Because once you have a TIA or a first stroke, the risk of having another one goes up. So among the preventative treatments we may start in people include things like what we call antiplatelet agents, which include medications like aspirin and Plavix. There are anticoagulant medications such as warfarin. In patients who have carotid artery stenosis, if it's significant enough, we can perform surgery to clean out the blood vessel. We can also place stents in the blood vessel to open it up so that blood flow is improved through to the brain. So there are a number of things that we can do to prevent strokes. And this is just, a nice little picture showing a good result in a patient who came in with a stroke. And you can see here on this left side here that there's no blood flow through the vessel here. And they're given TPA, and now you see two nice blood vessels going up in the brain. So, it's always fulfilling when we can help people and reverse the signs of their stroke. But it's even better if we can educate people on how they can prevent and reduce their risk of having a stroke. As far as hemorrhagic stroke, what we do to treat that, most importantly, like I said, most hemorrhages are caused by high blood pressure. So it's very important that we watch people, we lower their blood pressure to reduce their risk of re-hemorrhaging or to reduce the hemorrhage from getting bigger. Some of the things that we also offer include surgery. So in select patients, we can actually evacuate or remove the blood that's there. In patients who have bleeding related to aneurysm or arteriovenous malformations, we can do endovascular procedures to coil the aneurysms or to embolize these abnormal tangle of blood vessels. So, there's a lot we can do. In people who come in on Coumadin, we always try to reverse the INR, which is an indicator of how thin the blood is. So risk factors for stroke. Risk factors include those that can't be changed and those that can be changed. So among the ones that can't be changed include age. So for every decade above the age of 55, the risk of stroke actually doubles. So so that's something to be aware of. We can't control that. Heredity, that also affects the risk of stroke. Gender, overall men tend to have a higher risk of stroke than women, except in the age group between 25 and 35. In that group, women tend to be a little bit higher as far as their stroke risk. A history of having prior stroke, TIA, or a heart attack also places people at having a higher risk of stroke. So things that we can actually control include high blood pressure. So high blood pressure can be treated through what we call lifestyle modification. So if people exercise, watch how much salt they take in, watch their diet, so on and so forth. And also through medications, high blood pressure can be controlled. For people who smoke, we always advise them not to smoke. For patients with diabetes, keeping the blood sugars under tight control is very important. And anyone who has carotid artery disease, it's important that if their carotid artery stenosis gets to a certain point, that they be evaluated for surgery or some sort of procedure. In people who have abnormal heart rhythms, such as atrial fibrillation, we need to consider putting them on anticoagulation medication. And then other heart disease, too, we have to address and treat appropriately. Other things that also can be treated in people with sickle cell disease through close monitoring and things like blood exchange transfusion, the risk of stroke can be lowered. High cholesterol needs to be treated as well through medication and lifestyle modifications that I quoted before. Having a poor diet, you know, we always advocate that we have a diet rich in fruits and vegetables, high in fiber, to help prevent strokes. Physical inactivity, it's very important, and this is one of the biggest ones that I always push. You know, we have all these risk factors, but the biggest one that we should really push people towards is activity. Because I think the one thing that time and time again has proven to prevent diseases and treat diseases is exercise. So if we can get in about up to a half an hour of some sort of moderate level activity exercise a day, then that is excellent. And obesity too, you know, it's important that we educate people about losing weight and lowering their body mass index. So again, this is just to summarize, how can you reduce your risk of stroke, control your blood pressure, don't smoke, consume less sodium, so try not to cook with too much salt, and you know, if you need to add anything, add it later, but if you don't cook with it up front, that's better for you. Lose any excess weight that you may have, and really most importantly, stay physically active. And so other things that will probably reduce the risk of stroke, some of these things include limiting alcohol intake. So right now the recommendation is that for men, they should have no more than 2 alcoholic drinks a day. For women, it's 1. Don't use illicit drugs, because drug use is also linked to various types of stroke. For women who have a history of smoking or blood clot formation, they should not take oral contraceptives, because that makes them more prone to developing blood clots. And in people who have sleep-disordered breathing, so in people with obstructive sleep apnea, we screen for this as well, because we now know that obstructive sleep apnea is also a risk factor for stroke and heart disease. So that's another one that we don't think about too often, but it's actually a proven risk factor. So once you have a stroke, so we took it from recognizing the signs and symptoms, getting to the hospital immediately, what are the things that we can do for you once you come to the hospital, and how we can prevent the next stroke. But once, you know, despite all this, once the stroke actually does happen, what's the important thing that you have to do? Well, of course, we have to continue preventing the prevention of another stroke and risk factor modification, but it's very important to start a rehab program as soon as possible, because through the rehab, we can actually cause a little bit of rewiring of the brain, so that some of the function can return back. So it's very important. In every stroke patient who comes in, we do a full assessment for rehab, and we try to recommend a rehab program appropriate to their needs. So rehab, really the goal of rehab is to try to get people to become functional, independent, you know, to the best that they can. So teaching things like self-care, mobility, communication, cognitive skills, and social skills to everybody. Believe it or not, I mean, we have to retrain everybody, because if you stop speaking, we have to teach you again how to speak. If you have trouble walking, we want to get you up and walking again. And the sooner we get you on that path, the more likely it is that you'll improve. There are different types of rehab, so not everybody has the same needs. So some people may need something like acute care rehab, which is more aggressive. There are rehab hospitals that we send people to. There are long-term nursing care facilities, home-based programs, and outpatient programs that we refer people to, depending on how, you know, what we actually need to work on. Once a person gets into a rehab program, the type of specialists they work with include physicians, particularly physiatrists, we call them. So these are the rehab doctors who assess everybody and actually create a sort of treatment plan for the patient. There are rehab nurses, physical therapists, occupational therapists, speech therapists. So they have every type of specialist to help work on certain goals for the patient. There's also language therapists, audiologists, psychologists, and psychiatrists as well involved in all this. So, I'd like to end on, we're getting close to the end. So the type of hospitals are important to know. So if a person has stroke symptoms, it's very important that they go to a certified stroke center. And there are two types of designated stroke centers in the state of New Jersey. We have primary stroke centers and comprehensive stroke centers. So at primary stroke centers, basically these are centers where they have an acute stroke team that consists of ER physicians, neurologists, and nurses. And basically they have the ability to administer intravenous TPA and to care for patients once they're in the hospital. At comprehensive stroke centers, like it sounds, they have more comprehensive things that are available. So they can do things like perform neurosurgical procedures, endovascular procedures, and they also have comprehensive rehabilitation services that are available. And part of the team the team not only includes ER physicians, neurologists, and nurses, but it also includes neurosurgeons, endovascular specialists, neuroradiologists, and physiatrists. So it's a little bit more of a bigger team. At comprehensive stroke centers, there's also research protocols that are done. So like at JFK, we have about 5 or 6 research clinical trials that we do, and we actively participate in stroke research and publications as well. So it's a little bit more academic, and we're trying to be on the cutting edge and develop new treatments for people. We also provide education not only to our community, but to various staff and to our trainees as well. So examples of local primary stroke centers just in the area, we have Raritan Bay and Perth Amboy, Trinitas and Elizabeth, and Somerset Medical Center. And a few of our local comprehensive centers include JFK Medical Center, Robert Wood, and Overlook. And one little thing that I just want to brag about for us here at JFK is not only are we a state-designated comprehensive stroke center, but the Joint Commission also started a certification program for comprehensive stroke centers, and this started last year in September, and JFK is the first comprehensive stroke center in the tri-state area. So it's, so now we have a little bit of a little feather in our cap, as well. So if you need any more information about stroke centers, I have this website, strokeinformation.net, where you can read up a little bit more. The American Heart Association and the American Stroke Association also has a lot of educational information for patients and their caregivers, so there's a lot out there available. And if you are a stroke survivor, caregiver, family member, there is actually a magazine called Stroke Connection that one can subscribe to, which is a free subscription from the Stroke Association. So, okay. So I'm done with my talk. Thank you guys for listening. All right, thank you so much. I appreciate you guys coming. And please, just remember, act fast, recognize the symptoms.